you to this insightful webinar. We are honored to have such a distinguished gathering of medical professionals here today. So before we start today's session, allow me to introduce our company, Hetero Healthcare. Hetero Healthcare is determined to stay a step ahead to deliver superior and innovative care. Hetero Healthcare have established 300 products in portfolio and are pioneers in quality and innovation. We have also launched 4 biosimilar products within 5 years in the market and have strong global presence in over 126 countries. The topic of today's webinar is enzymatic preparations with Papain advantage in dentistry. To shed the light, we are privileged to have Dr. Satish Kumar Menon with us. Welcome, sir. Dr. Satish Kumar Menon is MDS in periodontics with 10 plus years of experience. He is the founder of Kazan Dental and practices exclusively in periodontology and implant dentistry in Navi Mumbai. He has also published various papers in the field of periodontistry. He has a YouTube channel with 54,000 subscribers and Instagram page of 19,000 followers. BDS Launchpad, Dental Launchpad are the few books which he are written by him. So let me welcome Dr. Menon to this session. Dr. Menon, please you can start the session.
Thank you. Thanks a lot for those kind words. It's always amazing that at around 3 o'clock, that's in the afternoon, between your morning session of dentistry and evening session of dentistry, you're taking out time to come and listen to this webinar. That shows the interest we dentists generally have towards such programs where we get to learn more. And it's not related to maybe the young dentists. Even you have senior dentists who have been practicing for 15 years, 20 years. They always make it an effort, even from their busy schedule, to attend such lectures, even in afternoons, and even whether it's a Sunday or a Saturday or something of that sort. Not just that, many of us travel to listen to more continuing dental education programs. But have you wondered why we as dentists do that? It's because we always want to keep on upgrading ourselves and keep on improving ourselves. And if you ask various dentists, why do they want to upgrade? Why do they want to improve their quality of dental services? You will get a variety of answers. Your answer might be you want more patients so that you do better treatments, they are satisfied, and they refer further patients to you. Other people might say that I want more amount of income. So the better quality of treatment I provide, the better quality of treatment I do, the more happier my patients are, the more income I will earn. This is so that they can support their family, help people, and support the people around them. For others, it might be just because of respect and satisfaction they get at the end of the day. When the patient is happy, they can go back, sit, and think, I've done a good job. My patient is happy, my team is happy, everyone thinks I'm a good dentist. That is what I want from life. So the bottom line is we all want happier patients, because if our quality is better, our work is better, these happy patients refer more patients. When you get more referrals, you get more income. And eventually there is a satisfaction and respect which comes within among dentists as well and between your patients for you. So we as dentists, our final aim is to get happy patients. But have you sat and wondered what our patients want? You might have different types of patients walking into your practice. One might be that old uncle who might have a false teeth completely dentures, or just got a recent denture done, shaking teeth, walking, crippling into your practice. Or you might have that young patient who is their 30s or 40s, working well, the IT crowd doing good for themselves, want to enhance their smile. Then you might have a child walking into your practice who's actually dragged in by the parent. They might be having a pain, or there might be something black in their tooth, so they are worried or concerned what it is about. What do these patients want? Why do people actually come to us? If you look at it and you ask yourself, the most common joke all dentists make among ourselves is, मेरे patient को discount ही चाहिए. That is, my patient wants cheap treatment and they are happy. But I want to ask you one question. Ask yourself this. In your area, do you know practices who are charging a lot and they're completely packed. You do not get appointments in their practice. And there are certain practice who are charging absolutely peanuts for the treatment and still they do not have enough patients. So is it always true that your patient wants discount? Would you find a doctor for yourself and your health just based on discount? Absolutely no. So discount is not always the milestone that a patient looks for. Then we say ourselves, my patients are looking for good quality treatment. Let me take you back to the case whether you have done or maybe has done in your practice. The root canal was absolutely perfect, but the patient has some amount of pain. And the patient tells, I am not at all satisfied with the treatment. They point out to another tooth which was done somewhere else, a root canal, and they do not have pain in that tooth since last 10-15 years. But when you take an x-ray of that tooth where they do not have pain, the GP is short or it is overextended or just a root canal opening is done, nothing is filled inside and the patient has no pain and is satisfied. And though you have done perfect root canals, the patient has pain or discomfort and is not satisfied. So are they looking for the ideal treatment when they walk into your practice? No, right? We are fooling ourselves by saying that patients want absolutely perfectly looking smile. Yes, when it comes to aesthetics, maybe. But do you think the lower third molar, or where you give a onlay or something, they're looking at the margin? No, that's not what they're looking for. So, what our patients actually want? They want basically three things. One is function. When they are chewing, eating, there should be no discomfort. There should be no problem. There should be no food getting stuck. Second, aesthetics. When it comes to the front teeth, anti ears, they want perfect smile. They do not want others to tell it is fake. They want to feel confident about themselves. And third is during, before, and after the procedure, they want less or no discomfort. You'll say, all your patients say, I get scared going to the dentist because बहुत दर्द होता है. It pains a lot. After the procedure, doctor, will it pain once we do this procedure? Now to you're giving injection. So their concern is related to these three aspects: function, aesthetics, and less or no discomfort. For function and aesthetics, it's your clinical skills, how good you are at work, that is very important. But to reduce the discomfort before and after the procedure, we always, since dentistry has started, have taken help of medications and drugs. Now, these medications play a vital role in reducing the discomfort post procedure. Post procedure means what? You have already taken care of the infection. So the pain and discomfort is usually not just due to the infection, but it is due to inflammation. Now, what is inflammation? It comes from the Latin word meaning to set fire. Imagine someone is setting you on fire. That is how you feel when your body is inflamed. That is, when any trauma, external injury, it can be due to chemicals, due to bacteria, some physical trauma, a cut given by a blade, that causes a body reaction. And that body reaction is known as inflammation. There are five signs which are seen with this inflammation. That is heat, redness, swelling, and pain. These are the major four which we see in dentistry. The fifth one is loss of function, also known as functional functionalacia. This is not seen frequently in dentistry unless maybe it's a third molar. The swelling post inflammation is so huge that the patient cannot open their mouth or finding discomfort to talk as such. Rest 4 is something which we commonly can see after basic procedures, maybe like a simple extraction you have done. So the point is this inflammation good or bad? Inflammation is basically a body response. When it happens for a short duration, it's like a defense mechanism. It's like saying war. Is war good or bad? It's bad. But if someone is attacking you, should you go to war? Absolutely, you should, because it's a defense mechanism. Similarly, when there is acute inflammation, injury, or trauma, this inflammation is trying to defend your body by creating these situations where the heat tries and kills all the bacteria out there by increasing the temperature. The swelling gets blood supply out to the area which has various mediators which can attack into all those bacterial infections or viral infections which come in. So in a short duration, inflammation is actually good. But if it is consistently happening over a long period of time on your body, then it can lead to various problems like cardiovascular diseases, neurovascular diseases, rheumatoid arthritis, even cancers. So short-term inflammation is a good response for the body, but if it stays for long and becomes chronic inflammation, it can cause more damage. Even when this inflammation is in a short duration, you want to control it so that it causes less discomfort and pain to your patient. Now, why does this happen? Let us understand inflammation. Whenever there is an injury or a trauma, there are certain things which come to a sight. Let us take an example of an accident. You're passing through the road. You see an accident happening towards your left. Suddenly, once that accident happens, a lot of people get collected out there. They go gather around the accident site. A few of them will call the police so that they take care of the traffic around there. Others will call the doctors or the ambulance for emergency services so the injured can be taken care of. Whereas the rest, they'll call your friends, they'll be taking selfies and just accumulating around that site. Similarly, when there is a trauma or injury to your tissue, there are certain cells which are there which find out that there is an injury here. They either have pre-existing mediators in them or they create mediators, and these mediators go and inform other cells that there is an injury out here, because of which the plasma which is passing through the blood vessels opens up the blood vessels, and there is slight seepage of this plasma and other cell mediated plasma mediated enzymes which enter into this site and start the inflammatory action, which is acute inflammatory in the initial stage, to try and protect the body, which includes various stages like clot formation, inflammation, and then the further stages of healing. So why is this important? You need to understand two factors: the chemical mediators and the plasma mediators. The plasma mediators and cell-derived mediators. Both of these are chemical mediators. Now remember I told you when there is an accident, there are people already there. Those are the cell-derived mediators, people who are already present around there. They either have mediators within them, those cells, which call histamine and serotonin, which call various platelets and mast cells and basophils into the site, or they have to synthesize it at that point of time. Then the plasma derived cells are of two types. One is the factor 12 system, and the second is the complement activation system. I'm sure you remember some part of this was taught during your physiology and pathology days of BDS. And you will be thinking, why even I'm listening to this? How does this affect my patient? I want my patient satisfied. I want them having no discomfort. What is all this cell mediated and plasma mediated factors going to help me? Remember, as dentists, we are dealing with inflammation day in and day out. The small extraction you have done, inflammation. The RCO you have opened, inflammation. The drilling you have done to place your implant, you're causing inflammation, you're causing trauma. Even if you're closing an injured site with a suture, the piercing of the tissue by a needle is causing trauma and inflammation. So it is this inflammation which causes discomfort to your patient. And study after study, when patients are asked, why are they scared of dentists? It is pain during, that's why the fear of anesthesia and injections, and the pain after the procedure. So we as dentists, if we are interested in getting our patients happy, we need to solve for this pain and discomfort. And mainly at which stage of cycle we have to solve it. We want hemostasis? Absolutely yes. Does it make sense after 2 months the patient has no discomfort or something? No. It's the first 6-7 days where there is inflammation, the signs we have discussed, pain, swelling, redness, all those happen severely in the first 7 days after or during a procedure. So we have to take care at that particular point. So understanding this is very important. And we have been giving painkillers always since the evolution of dentistry to try and suppress this pain. But remember, as everything has evolved, even pharmacology has evolved, and we have realized Not just painkillers, there are certain enzymes which can be extremely beneficial in reducing the discomfort and healing and increasing the healing of your patient. Similarly, one product is Tolib. Now, Tolib is made by Hetero Healthcare, a company which is seen having more than 300 medications which they produce and create. Other than that, they are also present across 126 countries. So, it's a group of enzymes created by a company which we know has been serving the medical fraternity since ages. So, absolutely, this group of enzymes is going to be effective. But we as dentists, when we prescribe something to a patient, it is our duty to know what it contains and how does each of this thing, the enzyme, affects our patient. Would you like to go to a doctor who prescribes you a medication and does not know what it does just because an MR told you? Similarly, as dentists, it's our responsibility to know why are we prescribing Tolib and what are the advantages of it. So let's break it down. The first enzyme which is seen is trypsin. I'm sure if you scratch your head and go back in time, this is an enzyme you have studied in your BDS physiology. Trypsin is something which is produced by the body already in the pancreas. It enters into the duodenum through the pancreatic duct, where it is broken down into trypsinogen. So if something is already present in our body, why do we give it? Why are we giving it externally? What are the advantages of it? First is it reduces vascular permeability. Second, it reduces pro-inflammatory cytokines or mediators. What do these two things mean? Remember, I give you an example of an accident which takes place, and people from the road, once they see the accident, start accumulating out there. Similarly, vascular permeability is when your blood vessels open up, all the blood cells try and enter to the site of trauma, which could lead to increased swelling. And you do not want that. You want controlled swelling out there so that the healing takes place, but there is no major swelling out there. So what do? You call the police so that they keep the traffic moving. Similarly, trypsin sees that the vascular permeability is reduced and the blood flow continues to move smoothly out there, decreasing the swelling, as well as it suppresses pro-inflammatory cytokines. These are those mediators who are making calls and asking other plasma cells to come. They include tumor necrosis factor alpha, interleukin 1, as well as and others. The next thing it does is fibrinolysis. Now, what is fibrinolysis? Whenever there is injury, there has to be healing and clot formation, which we want. We want clot to form there and form a hemostatic seal. But imagine in your house, if there is a hole, you call in a wall and you call people to repair it. They seal that entire wall and they go. But they leave their tools, remnants, and all the debris and cement which they created adjacent to the wall. What will happen to your house? It will be bad, right? Similarly, once the clot is formed, you want some amount of fibrinolytic activity to break down the excessive products which are there so that it moves on to the next stage after inflammation, that is a proliferative stage, followed by modeling stage. Similarly, trypsin helps in that fibrinolysis. It is also seen to be very effective in cases of burns. The point is, we understood trypsin, we understood its advantages. But does it actually work? Should we prescribe it to our patients? For that, we should see whether it has been used before. And our medical colleagues, that's the MBBS graduates, have been using trypsin since long in cases like diabetic cellulitis, ulcers, rheumatoid arthritis, and even ocular disorders. So we know it's a drug, an enzyme which is effective, and our MBBS colleagues have been using it successfully. So why should we as dentists not use it? Therefore, trypsin is an added advantage as an enzyme. But what are the other enzymes? Why am I giving a combination of four enzymes? The next one is bromelain. Bromelain is basically a cysteine protease and it's found in pineapple. As we know, pineapple is healthy. But what is its Advantage. Why do we take out something from pineapple and give it to our patients? It has a long list. For example, it reduces prostaglandins, that is again we have discussed the initial mediators. It inhibits bradykinin, again an mediator. It reduces tumor necrosis factor alpha, interleukin 1 beta. Again, it reduces the mediators. The other thing, we spoke about trypsin. Once the fibrin activity is formed, it causes fibrinolysis. Bromelain prevents initial excessive clot aggregation out there, so that the repair activity required to do fibrinolysis automatically is less. So it inhibits platelet aggregation as well. Again, should we prescribe bromelain? And the answer is our medical colleagues have been prescribing it. There have been studies which have been done which have stated that if I give bromelain before a surgery, post surgery, the healing is faster. It's already used to treat athletes. So if we know an enzyme is effective, we know it's being used, why should we not give it to our patients? We should. But then comes in the third enzyme, which is rutoside. Now, rutoside is again easily formed in buckwheat, in tea, in apple. But why do you take an enzyme from that and give it to our patients? The answer is again the same. It has a multiple action enzyme. It helps in inhibiting platelet aggregation, decreases vascular permeability, improves vascular flow, suppresses tumor necrosis factor alpha and interleukin 1 beta, as well as strengthens the capillaries. So, rutoside again is an enzyme which is effective. Then, same question, do our MBBS colleagues prescribe it? And the answer again is yes. It is used in rheumatoid arthritis and other inflammatory diseases. So yes, it's an added advantage and this enzyme is absolutely helpful. Now the combination of these three enzymes can be found in other enzymatic drugs which are available in the market. But there is one game-changing enzyme which is not seen in the other enzyme combinations which are available, and that is papain. So why, if we have a combination of three enzymes available, add a fourth enzyme? And why is papain beneficial? Let's get into the basics of papain. How is this papain formed? Why is it called papain? First thing is it comes from papaya. Have you seen those green raw papayas hanging on trees? If you have not, whenever they form, they're initially green and raw. So they take out blades or knives and they give cuts onto it. From that, a whitish liquid is seen which oozes out. That whitish liquid is collected, and from that you get, that's known as latex of papaya fruit. From that the papain is removed. And the advantage of papain, if you see the list, is a lot more compared to just having three enzymes. It strengthens the blood vessels, it has anti-inflammatory activities, it has antioxidant activities, as well as it improves microcirculation. Why are we giving a combination of these four drugs when we already had certain enzymes which were one combination or two combination? Why are we doing that? The first thing is we know papain is extremely effective. There have been studies which have shown that it is being used in burns, diabetic foot ulcers, leg ulcers, pressure ulcers, even in various traumas and sports injuries. So the advantage of using such a combination or a synergistic effect is together these enzymes are more effective. When we talk about teams, you might have a good player, but imagine having a good team. Who do you think always succeeds? A good player or a good team? Majority of the times it's a good team because they're working in sync or synergistically. Similarly, having this combination of four enzymes is seen to be more effective. Now, I am telling you it is effective. The company is telling you it is effective. Should you actually just listen to me or listen to the company and prescribe it to your patients? We are more smarter than that. We are dentists. You know more than that. You would not just randomly listen to someone telling and buy it. Now, how do you decide? There is something known as research. Imagine you have 10 patients in your practice. For some surgery, they have come in. 5 you give Tolib, 5 you do not give Tolib. And you see which patients heal faster and better. Imagine the 5 patients you give Tolib heal faster. What does that mean? Tolib is more effective. And such a study has already been done. In Savita Dental College, they found 60 patients who required third molar extractions. They divided them into two groups, 30 each. Post extraction, in one group of patients, they did not prescribe Tolib. In the other set of patients, they prescribed Tolib. And after that, you can see the conclusion. Use of papain appears to be associated with reduction of soft tissue swelling, improved mouth opening when compared to conventional therapy. It means in patients who gave their Tolib, they had lesser swelling, more improved mouth opening. And if you see it, there is even patient-based response stating that with Tolib they felt better. So as patients want less discomfort, isn't it our duty as dentists to try and provide that? And we know there is a synergistic enzyme which actually does the job. Therefore, you should prescribe it. Yes. But the next question would be, in which cases? Every patient who walks into my practice, do I prescribe Tolib? It is in those cases where you are expecting some amount of inflammation or swelling. This can be post regular extraction, post third molar surgeries, post implant placements, disimpactions, jaw fractures, anywhere where post procedure you are expecting swelling, pain, and discomfort, Tolib can be prescribed. The next part is what is the dosage? The dosage is twice daily for as long as required. As long as required doesn't mean you give it for 1 month or 2 months. Usually, after your procedure, how many days your patients have a swelling? 5 days, 7 days, 10 days, depending upon what procedure it is and how traumatic it was, and with what stage the patient came. So, based on that, 5 to 7 days is what I would suggest you should be prescribing Tolib for twice daily, depending upon what type of procedure you have done. The next question you would have is, should I give it to each and every extraction case? Is there any contraindication or side effects? When it comes to side effects, I hope you remember your pharmacology. What is the common side effect? Nausea, vomiting, diarrhea. This is the same side effect which is seen in certain patients, rarely, as a side effect of Tolib. The next thing is there any contraindication where we should just not prescribe it? In that, we had discussed in the start that bromelain prevents platelet aggregation itself. So it reduces clot formation speed in cases where already the patient is on a blood thinner like a warfarin. It is something which you should not prescribe, because there you're okay with some amount of swelling, but you want better clot formation, better healing. You are okay with slight discomfort, but you want a proper seal. So where you feel the patient is on a blood thinner like warfarin, you can avoid prescribing this. It is also said not to be given if the patient is on certain antidepressants. Avoid it. The third is, studies are not done enough in pregnant and lactating mothers. So it is not an absolute contraindication as such because we do not have studies. But it is better to be safe as dentists. Do not prescribe it in pregnancy and lactating mothers. Avoid it in patients who are on warfarin and in patients who are taking certain sedative drugs. Other than these, if you feel your patient is going to have swelling or pain or discomfort, you should always prescribe Tolib. Because, like we spoke in the start, we're taking all this effort, this time to study, learn more. Why? Because we want happy patients. And what do our patients want? Three things: function, aesthetics, and less or no discomfort. And this is where Tolib from Hetero Healthcare makes a difference. So understand why you're prescribing and prescribe it to help your patients. So we're done with today's session. Are there any questions?
Participating doctors, if you have any questions, you can type in the chat box. Those questions will directly reach to Dr. Satish. If you have any questions, you can type in. doctors. If you have any questions, you can type in the chat box. I guess questions so far so good. So yeah, Dr. Satish, thank you so much for such an insightful webinar, helping us understand TOLIV in a better way. Hope it helps everyone who have joined in. Thank you so much for your time. Thank you, doctors, for joining in all over. Thank you.